Today we are talking about NAD. What are some benefits of it? Should you take it? And what actually is it? NAD is considered one of the most important anti-aging molecules that can be found in the body. In fact, it's considered to be the second most abundant molecule in your body, only behind water. And NAD is involved in over 500 known biological processes, with Lord knows how many more processes that we haven't identified yet. NAD levels are the highest when we are in our youth. And by the time we hit our 50s, about half of all your endogenous NAD levels have declined. And this steady decline is attributed to a few reasons. For one, we can't recycle it as well as we get older. And two, chronic inflammation can lead to depletion of your NAD levels. Over time, this chronic depletion of your NAD levels eventually leads to cellular dysfunction, which, from a whole body perspective, can lead to cognitive dysfunction, cardiovascular dysfunction, immune dysfunction, metabolic dysfunction, you name it. So, what exactly does NAD do? To put it simply, it's essentially a fuel source for all of your cells. What NAD does ultimately is that it helps increase ATP. I like to refer to this as a form of quote unquote cellular currency because it's a fuel source that your cells can use and tap into. Furthermore, it plays a role as a coenzyme for countless biological processes. So, how do you take NAD? The most common way that most people will take NAD is through an IV, intravenous. In other words, they'll do it over a drip, sometimes over 2, 3 hours, because if you do it a little bit quick, you may get like an uncomfortable feeling in your chest, may feel a little flushed, but most people tolerate it quite well. Alternatively, you can do subcutaneous injections. That's what the vast majority of our patients prefer to do just because they grab an insulin syringe and pop it in a few times a week. Some people do low dose once a day. Some people have them do it 2, 3 times a week. Whatever. We'll meet halfway, kind of figure it out. Intramuscular injections, that's another method that you can do it as well. Some of our compound pharmacies actually compound a topical, which is great for like localized injuries. Say if you have scarring, say if you have some post surgical wound, you can put it on topically. That does help out the area heal a little bit quicker. You can alternatively put it on your skin if you want to have more of a cosmetic anti aging look. And another one of our compound pharmacies also does it as a nasal spray. So you can do that once a day, once in each nose. It gets the job done. But ultimately, what we found works the best would be either the IV or do some sort of an injection.